Hello, this is Dr. Do again. This video is on alphabetic list of problems, still on letter I. Today I'm going to talk about a condition, a cluster of conditions occur to the eyes called intraocular diseases. If you follow my previous videos, I have talked about individual diseases of eye diseases from the cornea to glaucoma, but today I'm just going to put everything together in this video, intraocular diseases. So as you know, let me just bring up the emergency situation, what kind of signs you're looking for to see the ophthalmologist or to see the emergency right away. First of all, the sudden change of visual acuity, or sudden change of vision with or without pain, or with or without headaches, or with or without any symptoms, or the injury, acute injury, either chemical or mechanical, and cannot treat at home by yourself. You have to see the emergency room, or especially the visual change after for those pre-existing conditions, hypertension, diabetes, of course, for the older people, or regardless of age, young or old, have a high degree of myopia, nearsighted, if particularly after the sport or vigorous shaking, a kind of jerking movement, you change the vision, you find the vision acuity change. So this is also some sign you need to see your physician, particularly those feeling like a curtain falling down to the eyes. So these are the signs. See your physician, the sooner the better, the ophthalmologist or the emergency, or call your primary care, just to make sure you contact your professional physicians and to guide you, either see ophthalmologist or emergency. Are there any conditions associated with this intraocular disease you can manage at home? Pretty much, if I talk about intraocular, I refer to the inside, not the conjunctiva or the cornea, but I'm going to briefly mention them. If the conjunctiva, like the pink eyes or itchy eyes during the allergic season caused by the allergy, you may manage at home, but still need to check. I think my recommendation is check with your physician, either specialist or your primary care or emergency, to exclude all the serious problems and confirm the diagnosis. And then, even though not prescribed medication, you use the eye drop from the over-the-counter, but still you need to be guided under the professions. So this is about the two end, emergency and or manage at home. And in general, intraocular disease really refer to the structure, the lens, the iris, and the posterior retina, and also the associated structures. Like on the surface of the eyes, we can see the cornea, the transparent part, and also the sclera, the white part. On top of this sclera, there's a thin, also cover the eyelids, or the conjunctiva. So these are the structures really tend to have the symptoms prone to, if the infection or if the injury. Those are the structures tend to be the first to be affected. So the symptoms for those either infection or injury, you feel painful, very painful, and itchy, and sometimes red, sometimes you cannot see red. But regardless, particularly for those had high risk wearing the contact lenses, if you develop this eye pain, or particularly associated with discharge, call your ophthalmologist right away to check it. Because that, especially for special kind of contact lenses, you're not supposed to sleep with them, but you did accidentally because you're so busy. If that happened, and with discharge and painful, you need to see your physicians. And the other common condition I talk about is the lens. The lens associated with lens conditions are the refractory disorders, either myopia or the farsighted, nearsighted or farsighted. This has to be managed by all kind of doctors, either medical or non-medical. They can prescribe your eyeglasses and you have to correct it. And the other common conditions associated with lens are the cataract. I think I have a previous video talk about that. Usually occur after 40 years old. Is a degenerative change with calcifications, the protein, and also the structure, and the lens becomes hardened and obscure and not clear, so that develop the cataract. Usually, this has to be managed by the ophthalmologist to confirm diagnosis, to follow. At the beginning, probably you do not know it. The symptoms for the severe cataracts are the night vision impaired, especially you see the glares, especially driving during night, the light from the opposite side shining upon your eyes, you just feel so difficult to see. So if that's the case, especially if you're older than 40, 50 years old, get your ophthalmologist on board to check and make sure to diagnose and also to treat. The surgery is kind of for 30 minutes or even less, quite straightforward, but the pre-surgical workups need effort, time to get it done. So this is the other important intraocular disease are the iris. Iris is the black part around the pupil and serve as the contain the muscles to dilate or constrict the pupil, and also contain the secretory cells for the aqueous fluid. So the inflammation of this iris could be many causes. Could be infection or could be autoimmune or associated with other systemic disease. The symptoms are very painful and may or may not have hemorrhage. But if you have this, usually probably diagnosed as early age or associated with your other systemic disease, then you need to follow up with your physicians regularly and treat it accordingly. And it could be very painful and red for the eyes. So that's the inflammation of the iris. And the other group of very serious intraocular disease are of course the retinal disease, either with or without systemic disease like hypertension, diabetes. I'm sure if you had this chronic disease, you have been told to follow up with your ophthalmologist once or twice, or once or every 2 years to have the baseline and then to follow up. Make sure there are no retinopathy associated with these diseases. And there's another very common, and the onset age kind of earlier than previous thought, is the glaucoma, which is intraocular pressure elevated with or without. Actually, sometimes can have glaucoma with normal intraocular pressure. I think I have another video on this. I'm not going to talk details, but anyway, if those acute angle closure glaucoma is really threatening the sight, you may lose the sight. So see a physician or emergency as soon as possible. So these are the important, I think, I just skipping on the surface and pick up the sentiment. I think the important and very common, quite common diseases inside about the intraocular diseases. Of course, on top of that, the injury is also quite often. Usually the injury could be very superficial. So then, regardless, as I mentioned at the beginning of this video, if you have injury, see your ophthalmologist or emergency as soon as possible. So this is about the video of this intraocular diseases, and I just give you some idea what kind of signs, what kind of important symptoms associated with the individual diseases occurred inside of the eyes. So I hope it helps, and I'm going to stop here. Thank you for watching. I will see you next time.